Aloha, good afternoon, and welcome to one of our remodeled classrooms for the COVID-19 era here at UH Manoa. Today I'd like to announce the release of our system-wide guidelines for campus planning for post-COVID-19 instruction. These are in effect for the forthcoming academic year. And these are the guidelines to which all 10 UH campuses will be developing their operational plans. That work is underway now. On most of our campus websites, we have portions of those plans developed, but it's the release of these guidelines that really lays out everything that we expect all of our campuses to do across the islands. These guidelines were developed with the expertise of our faculty in health, public health, medicine, nursing, and other fields, and they rely very heavily and draw on guidance that's available to us from the Centers for Disease Control, the State Department of Health, and the county orders that are also in effect, which have slight variations. They cover pretty comprehensively all of the areas that we need to address to ensure a safe return to campus for many of our students and employees. And it's everything from the physical distancing in classrooms, which lowers the density, as you can see here today. We've addressed, importantly, the wearing of facial coverings. I have mine off for purposes of speaking into this microphone. Our faculty will actually be given those clear face shields for when they're teaching so that students are able to actually watch their lips and hear them better. But we will be expecting everyone inside a campus building to be wearing a facial covering, typically a cloth mask. Thank all of you for wearing them here today. The exclusions are if you are working alone at your desk 6 feet away from other people, that's not required, and they're also not required outside other than if you're interacting closely with other people. So that's a very common question. We are using a physical distancing of 6 feet. That is the current recommended guideline by the Centers for Disease Control. And that's what we're laying out as we have essentially, we're here in one classroom on one campus. This is the work our amazing staff are doing across the UH system, moving seats where they're mobile. In this case, you can see we have fixed seating, so we have no choice other than to simply render, in this case, most of the seats will not be available for regular instructional use. You also see signage up on the wall in between the periodic charts of the elements. We're here in a chemistry room, but reminding people of safe practices. And of course, the most important thing all of us can do to slow the spread of COVID-19 is to follow those safe practices. Facial coverings, washing your hands, not engaging in risky behaviors, and perhaps most importantly, if you are sick at all, stay home, and we will be emphasizing that. We also announced today that we will be deploying an app coupled to a website across the UH system, and every person who comes onto one of our campuses, students, employees, invited visitors, will be expected to conduct a daily health check. So that's a self-health check to ask if they have had symptoms, if they have traveled out of state in the last 14 days, if they have had close contact with anyone who has been diagnosed with COVID-19. We need those people to stay home, and we will get them the appropriate medical care, either getting them to their medical provider or we will find a way to help. We will be conducting testing. Everyone asked us in accord with CDC guidelines and Department of Health guidelines. I have to emphasize that right now, and CDC just announced new guidelines on testing for institutions of higher education 2 days ago. Those guidelines very clearly do not recommend testing of everyone who comes to a campus. Rather, they call for testing of anyone who is symptomatic and then they call for testing of people who are found to have had close contact with someone who has been diagnosed with COVID-19. I'll just cover a few more items and then open it up for questions. You can either text the questions in, I think members of the media have the number, or can email news@hawaii.edu. The guidelines cover regular cleaning and disinfecting of buildings, class spaces in buildings, classrooms, workspaces, and we'll be paying special attention to those shared spaces that are used by more than one person. Signage, as I mentioned, messaging that we'll be doing. We will have required training as well in accordance with OSHA requirements. We are reducing the number of students who will be engaged in face-to-face instruction. This has been a monumental task undertaken by our faculty, department chairs, and deans over these last weeks. There will be some face-to-face classes, there will be some fully online classes, and many, many more of our classes will be what we call hybrid, involving some face-to-face interaction in safe, physically distanced ways, but also much more online interactivity as well. Part of our classroom modification activities have been outfitting our classrooms. So far we have over 70 what we call Zoom capable, but really video capable classrooms where faculty will be able to teach from the classroom to students who may be in class, but also students who may be at home either for health reasons or simply for physical distancing reasons. We are adjusting the flow of people within buildings so that people are not crossing each other and breathing on each other between classes. Lots of modification to our residence halls, dramatic lowering of density. We already have concerns from students and parents about the limited number of dorm rooms. We are very apologetic for this, but we also feel it's in the best interest to promote the safety of the students who are living in our residence halls. And finally, I want to mention guidance for providing mental health support. This is an incredibly stressful experience for students, for faculty, for the rest of our employees, and we do want to make sure that the support they need is available to them. So with that, let me stop and see if there are any questions.
Are housing prices going to go up because there's less students living?
We have decided that even though there may be fewer students in the room, that's not their doing, and we will stick with the advertised room price. Sure. The question was whether we're going to be raising the student residence hall room prices because of the lower density, and the answer was no.
Yeah.
With other budget cuts, are there programs that will be specifically affected by the budget cuts?
So, not the topic for today's conversation, but absolutely. So we are working extremely hard while we're preparing for COVID-19 preparations on all of our campuses. It is very clear that there is less state money. Our budget is, our operating budget is composed primarily of our state appropriation, which we know will be lower, and tuition revenue. That story is still uncertain. Many students are still making up their minds about whether they will come back to school or not. We are optimistic that we'll have more in-state students, but we think our out-of-state student count is likely to go down. Today we're here at UH Manoa. Numbers are looking actually pretty good here. They're not looking as strong on some of our other campuses. We will be engaging in pretty strategic review of the opportunities for budget reductions. We don't think this is a simple matter of belt tightening and waiting to get through it. The economic conditions that have resulted in these budget cuts will not go away quickly. We've spent time watching what the legislature is doing, talking with State Department of Budget and Finance. I speak regularly with the governor, and it's clear this is a multi-year financial challenge for the state. Last recession, our budget did not, our general fund budget didn't recover for 5 or 6 years to what it had been before that recession. The actions during the current fiscal year, which started today, happy new fiscal year, everyone. Many of those will be fairly tactical, but moving forward, we will be making much more strategic decisions.
What's the enrollment like this fall?
The question was, what's the enrollment like this fall? The short answer is we really don't know yet. So we can track compared to last year at this time. In general, most of our units are down. But what we are seeing here and nationally is a great deal of indecision. People are deciding much later what they're going to do. So in particular, our mainland students have been struggling to understand how they can return here, and the 14-day quarantine was really a challenge. Now we've given them the guidance from the state, and they are now trying to figure out if they can get COVID-19 PCR tests where they are, so that when they arrive, they don't have to go into quarantine. So that has been a challenge for students and their families to make decisions. We also know that conversely, many local students are still deciding whether or not they should go off to the mainland, and particularly as they are seeing some universities that are going fully online, whether that's something that's worth going away for. So we think local students are making decisions late about enrolling here, but we did extend our application deadline to August 1st for exactly that reason, so that families, I won't name the names of states, but you can all see where states are having explosions of cases. We think families are reconsidering some decisions to send their students away to states that are clearly less healthy than Hawaii. And I will say we are one of the most healthy states, in spite of the number of cases is no longer in the 0 and 1, 2, 3 range most days. This is still an amazing place.
Can I keep asking?
Yeah.
Okay, and so you talked about that app, the health condition app. Is that a mandate for students and everyone who comes on?
Yes.
How do you enforce that?
That's a great, the question was whether the app that we're deploying will be mandatory and how we will enforce it. So one of the reasons these guidelines were described as interim is that we're beginning consultation with our unions now. We think it's in the best interest of all of our employees and their unions to want to keep people safe. And this is arguably the most important thing we can do, is keep people with symptoms away from campus. Secondly, wear facial coverings, and washing hands often, not touching face. Those behaviors are so impactful. We think there will be strong support for mandatory activities that are designed to keep everyone else safe.
So as far as the rules, it's still being developed right now on how to enforce it.
That's right. We're in consultation. We're just starting now with the unions. These interim guidelines, literally, we finished them yesterday as we promised, but we didn't publicize them till today.
Okay. And then as far as classes that have big lectures, like the biology ones that have hundreds of students inside, are those automatically going to be online because of the distancing?
So there are multiple options for very large sections. We will have no sections larger than 50. That's both to keep people safe and avoid very large gatherings, but also due to the limitations as we physically distance in our classrooms as well. What I will say is the modes may be going totally online, could be increasing number of sections, and could be going into hybrid environments. So we've just gotten all of the information from all the departments. That was all due into us yesterday at UH Manoa. Some campuses are ahead of that, some are a little bit behind, and we're using that to completely modify the fall course schedule. We've developed very specific and informative types of classes so that students will know exactly what the mode of the class will be when they're registering, and we'll be letting them change their course registration if they have a preference for more online, more hybrid, more face-to-face.
A question from Boyd is now Darrell Huff. Are you seeing many students who plan to go to the mainland, who are planning to go to the mainland, decide to begin their college career at UH? Will that balance off the loss of mainland or international students?
Do I have to repeat it?
No.
Okay. So we absolutely are seeing numbers that suggest an uptick in local resident students, and we believe that absolutely is because of families and students believing this is not a great time for students to go thousands of miles away from their families to places that, as I mentioned, are frankly less safe. We do not know yet how that will balance out. Interestingly, we are seeing strong interest from the western states of the U.S. We have a very favorable tuition program called WUI that's offered to the 15 western states. Again, as I mentioned, we are also a very safe place for someone to be sending their students and their family members. Big struggle with international students. Part of that is visa requirements and travel difficulties. So we are not expecting any uptick there. And we won't really know the extent to which the numbers balance out, and importantly for us, the tuition revenue numbers balance out until we really, are approaching the beginning of school, which is April 24th.
Question now from Hawaii Public Radio, Amy Nakamura. If a student cannot get tested before they arrive in the state, how will UH provide accommodations for students who need to complete their mandatory 14-day quarantine? Will they be allowed to quarantine in their dorms?
So I want to emphasize, we do believe there will be COVID-19 cases on our campuses during the fall. That's almost inevitable. Our students, our faculty, our staff are part of this community. This community has COVID-19 cases with community spread. This isn't an expectation of zero. So we have made arrangements for quarantining with local hotels for our campus residents, both here on Oahu and in Hilo. We are working with governmental officials to try and identify an alternate procedure that is acceptable to government officials who approve exceptions to the travel quarantine. And I'd like to be optimistic that we will have an alternative to the 14-day quarantine for students who absolutely cannot get a test. But I don't want to say much until we manage to get our way through that.
Do you have any hospitals in mind or hotels in mind?
We don't have a contract in place, so I don't want to say that just yet. But yes, we have. I want to thank HTA and the Hawaii Tourism and Lodging Association, which gave us some recommendations of hotels that they knew had vacant spaces but had remained open. So that gave us the opening to begin to do outreach.
Okay, we have a question from Hawaii Tribune Herald, Stephanie Salmons. And her question is, will tuition prices change because more classes will be offered online?
Tuition will not be changing. The University of Hawaii has a Board of Regents policy that clearly says online instruction is offered at the same price as face-to-face instruction. We firmly believe that our faculty can deliver quality instruction online. We are affordable. There are many ways to use technology that are highly engaging, and we've been clear from day one that tuition doesn't change as a result of instructional method. Whether you're in a large lecture, a small lab, online, hybrid, seminar, we charge tuition the same, based simply on graduate, undergraduate, and sometimes with fees that apply. Frankly, our costs are going up, not down in this mode of instruction. We have a lot of special preparation we're doing, and our people are all actively engaged in teaching, learning, and support services, including keeping everyone safe.
Can you talk a little bit about the student athletes, especially those on athletic scholarship? If there's no fall sports, will UH still honor their scholarships?
UH has no plans to withdraw any student athlete scholarships as a result of what may ensue because of COVID-19.
Is there a specific number or scenario that would trigger a total return to distant learning?
The question was whether there is a specific scenario that would trigger a total shutdown of a campus or campuses. We do not have a specific scenario. We will be working closely with public health officials. The situation could be different if the outbreak is localized to a campus. We may be advised in consultation with public health authorities that the best thing to do is stop all in-person activities. In those situations, we would pivot back, as we did in the spring, to fully online instruction. So I don't think we see a full shutdown. We would see a pivot. It is also highly plausible that there could be an outbreak on one island that would cause public health officials to change the guidance that's provided island-wide. And in that situation, again, we would be responsive. So, for example, what happened in the spring, while we announced early, clearly, if we hadn't announced early, we would have been told what to do anyway. I'm really proud of the work our faculty did and the resilience our students showed, and our amazing instructional technology support staff and technologists who managed to pull off the spring semester without much planning. And we have faculty at work across the system planning their courses as to how they will be offered in the fall. So we'll be much better at it in the fall than we were in the spring.
What's the cap in dorm rooms? I know there's a cap in classrooms. And then for people who don't have a place to stay, are they on their own, or does UH have other alternatives for them?
The question was about a cap on dorm rooms and whether UH is finding housing for people who can't get housing. So the physical distancing in the dorm rooms is very specific to each room type. So I don't have the exact number. Do you remember?
For UH, we know about 30.
So it's about 30%. So it's only about 30% of our normal capacity.
Oh, no, 60%.
I'm sorry, 30% reduced.
Yes.
So 70% of capacity.
Right.
We are trying to identify opportunities where we may be able to do bulk acquisition of rooms that might be suitable for student residents, and we have a couple initiatives underway. But in general, we're giving people notice that they're going to need to find housing, and we may not be able to help. I suspect that more students will live at home, particularly those who live on Oahu.
Another question from Hawaii News Now. Overall, how many fewer students will be on campus on a typical weekday than there would have been in a normal year?
Boy, I really don't have that number at all. I think we're going to be able to provide that by the time the semester starts, though.
Another question from Hawaii News Now. How are you handling food services?
So food services, thanks, great question. So there will be a combination of encouragement of grab and go. Dining areas will be physically distanced so that people adhere to the physical distancing requirements that have been in place, and now people are commonly seeing in restaurants as well. And there will be no kind of buffet service that creates opportunities for the spread of the coronavirus.
More questions from Hawaii News Now. Will alcohol be served on campus?
That's a good question.
Is Bali going to be open?
We have made no plans to change any of the alcohol provisions on any of our campuses. I think UH Manoa is the only campus that has an alcohol service location.
Okay, another question from Hawaii News Now. How will people be bringing in deliveries and mail on campus? Will they be monitored or screened?
We will expect everyone who comes onto our campuses to comply with our requirements. I don't think we've gotten to the details of, the UPS truck or the FedEx truck and exactly how that will work out. But certainly anybody who comes onto a campus, either as a guest lecturer, to use a library, to perhaps meet with the admissions office, they will be expected to comply with our health checks. My guess is when we start talking to organizations like FedEx and UPS, Postal Service, that they are probably deploying very similar means, and we may well be able to trust their daily health check procedures to complement ours.
Does that mean the public is invited back to the libraries and the dining facilities?
We are working through what it means to have members of the public on campus. In general, we'll be looking at invited guests only, so we're thinking that people will have to make arrangements. In general, the stacks are not open, so the library, as you probably at most of our campuses, the main use has been the computer labs that are available and check-in, check-out of services.
Another question from Hawaii News Now. Do you expect more commuters, more traffic? Or less because of online classes?
My guess is going to be less. I know everyone applauds that answer. I think the increased use of both online learning and hybrid classes will result in less traffic, but as the questioner correctly notes, reduced number of dorm rooms mean more people will have to get here from somewhere else. So how that balances out, I think, will be uncertain.
Another question from Hawaii Public Radio, Amy Nakamura. Is UH planning on holding a fall graduation or commencement ceremonies in person?
We have just started talking about what that would look like. We do not know what the physical distancing guidelines will be by the time December rolls around. Those of you who have followed the color coding, we would probably have to get all the way to blue in order to have a normal commencement ceremony. Not to shock our commencement team with whom I haven't shared this thought, but one possibility would be to invite the students to participate in person, and we probably could physically distance our graduates in Stan Sheriff, but we could not accommodate all of their families. And that's a possibility, and maybe we could webcast it for families and encourage them to find other ways to celebrate safely their pride in their graduates' accomplishments.
We have about 2 more minutes. Any more questions?
Quick clarification, you mentioned a lot of disinfecting. Is it hourly, daily? What's it going to be like?
Say it again?
The disinfection in
So it's going to
class-
depend on the question was about disinfection. So the system-wide guidelines require daily at least for shared spaces, but we're looking into spaces that are shared even more frequently and how they may be wiped down even more often. We are also figuring out what supplies we can get and whether we will have wipes or sanitizer bottles with something else. That's all part of the detailed work that each campus is undertaking now to implement, again, what are the system-wide guidelines.
Question from Kaleo. What types of mental health resources will be provided for students as stated in the interim plans?
That's exactly what we're working through now. I'm a member, so at Manoa we have a number of working groups. At Manoa we reviewed a proposal and we're looking at some alternatives as well. Could be a combination of staffing, could be drawing more completely and fully on the resources. We have some amazing faculty and frankly students, including graduate students, who may be willing and able to help us. And there are also commercial organizations that provide mental health services in a telehealth manner, which frankly many of our students might prefer getting their assistance online in an online format rather than going to an office and talking with someone.
Any more questions?
I have one last question, sir. Have you been talking to the athletic director on any decision getting closer on resuming sports or just canceling all of it?
The The question was about, have I been talking with the athletic director? Yes, I talk with the athletic director regularly. The University of Hawaii at Manoa is in 2 athletic conferences, the Mountain West Conference for football, the Big West Conference for everything else. I have spent more time with my fellow presidents. The presidents form the boards of both conferences. Neither of our conferences have come to definitive decisions about the initiation of sports in the fall. That's actually true of pretty much every conference in the country. So those discussions are still underway. I think we are all preparing as if it will be possible to hold sports in a safe manner, but we haven't made final decisions as to exactly what that will look like for the student athletes, for the coaches, and potentially for spectators. I almost thought I was going to get out of here without that question.
All right, thank you, everybody.
Okay, thanks everyone. Aloha.